As we age, our bodies begin to send us signals, sometimes subtle, other times loud and clear. One of the most common yet overlooked ways your body communicates is through the color of your urine. If you're over 70, you may notice changes in the shade, and while many people think it's simply a matter of hydration or diet, the truth is that certain colors can be a warning sign of deeper health issues. Have you ever caught yourself staring at the color of your urine and wondering, is this normal? It's easy to brush it off as something minor, but what if your body is trying to tell you something important? Whether it's a bright yellow hue or an unusual reddish tint, these colors may indicate everything from hydration levels to serious conditions like kidney disease or even bladder cancer. In this video, we're diving into what different urine colors mean after the age of 70 and what your body could be trying to communicate with you. Don't ignore those signals. Your health may depend on it. Urine isn't just a waste product. It's a powerful indicator of your overall health. For those over 70, changes in urine color can be more than just a sign of aging. They might be clues to potential health issues you can't afford to ignore. In this video, we'll explore the meanings behind the different colors you might notice in your urine after the age of 70. From hydration to kidney health, we'll break down what each color could be trying to tell you about your body's inner workings. Stay tuned as we uncover what your urine might be saying about your health. When we talk about urine, the first thing that comes to mind is often its color, but what does it really mean when the color changes? Especially for those over 70, our urine can reveal a lot more than just how hydrated we are. After 70, the body's systems, such as the kidneys and liver, begin to work a little differently, and the way they process fluids can directly impact the color of your urine. Clear to light yellow, the healthy range. For most people, clear or pale yellow urine is a good sign. It means you're well hydrated and your body is efficiently flushing out waste. But as we age, our kidneys' ability to concentrate urine may weaken slightly, leading to a more diluted or clearer appearance. This is especially common if you drink plenty of water or liquids throughout the day. It's still healthy, but if you notice it's consistently clear, it may be a sign to reduce your fluid intake a little to prevent overhydration. Though clear urine is usually not a cause for concern, it's worth noting that sometimes excess hydration can also dilute the concentration of important electrolytes in your body. This can lead to hyponatremia, a condition where your sodium levels become dangerously low. Symptoms include nausea, headache, confusion, and in extreme cases, seizures. This condition is rare but more common among older adults who may have reduced kidney function or who take medications that affect fluid balance. Pale to dark yellow, the ideal hue. If your urine is anywhere between pale yellow and dark yellow, you're likely in the ideal range. This color comes from urochrome, a natural pigment produced when your body breaks down hemoglobin. The darker the yellow, the more concentrated your urine is, meaning it's still getting rid of waste, but without excessive hydration. However, if your urine stays on the darker side, it could be a sign you need to drink more water to maintain balance. For seniors, this color is often associated with healthy kidney function and good hydration. However, it's important to remember that age can impact kidney efficiency. As you get older, your kidneys may become less effective at concentrating urine, so you may need to make extra efforts to ensure proper hydration. If the dark yellow persists, consider evaluating your fluid intake to avoid dehydration. Amber or honey, dehydration warning. If your urine starts to turn amber or honey-colored, it's a sign that you may be dehydrated. Dehydration is common among older adults, as the sensation of thirst often decreases with age. This can make it harder for you to recognize when your body needs fluids. If you notice that your urine is amber or deeper in color, it's time to drink more water. Chronic dehydration can lead to serious health conditions such as kidney stones, urinary tract infections, UTIs, and even kidney failure if left untreated. Seniors are particularly at risk because their kidneys may not be able to conserve water as efficiently as they did in younger years. If you're experiencing amber-colored urine along with symptoms like dry mouth, fatigue, and dizziness, it's time to hydrate and consult a healthcare provider if symptoms persist. Pink or red. Blood in urine. A surprising change in your urine color, pink or red, can be alarming, and understandably so. This color often signifies the presence of blood in your urine, a condition known as hematuria. While it's not always serious, it's essential to investigate further, especially after the age of 70. The reasons behind red or pink urine can range from minor issues like a urinary tract infection, UTI, to more severe conditions such as bladder or kidney cancer. One common cause of red urine in older adults is benign prostatic hyperplasia, BPH, which is an enlargement of the prostate gland. In some cases, BPH can lead to blood in the urine, especially if the prostate becomes irritated. On the other hand, urinary tract infections, UTIs, are more frequent in older women and can also cause blood in the urine, but these are far from the only potential causes. If you notice red or pink urine, it's critical to consult with your doctor, as it can also indicate kidney or bladder stones, trauma to the urinary tract, or even cancer. Your doctor will likely recommend tests like a urine analysis or imaging scans to determine the cause of the discoloration. If left untreated, some conditions associated with blood in the urine, like bladder cancer, can become life-threatening, so timely intervention is key. Brown or tea-colored, liver or muscle issues. Brown or tea-colored urine can indicate something more serious, particularly liver problems or muscle breakdown. The brown color comes from the presence of hemoglobin or myoglobin in the urine, which can occur when muscle tissue breaks down, a condition called rhabdomyolysis, or when the liver is not functioning properly. Older adults are more likely to experience liver issues, especially conditions like cirrhosis, hepatitis, or fatty liver disease, which can cause the urine to turn dark brown. Muscle breakdown, which could be linked to prolonged immobility or severe muscle injury, can also cause brown urine. Additionally, certain medications, like statins used to lower cholesterol, can increase the risk of muscle damage and lead to discolored urine. If you notice brown or tea-colored urine, it's important to seek medical attention immediately. The causes behind this discoloration can have serious implications, including liver failure or kidney damage if not treated promptly. Your doctor may recommend liver function tests or muscle enzyme tests to check for underlying conditions. Blue or green, rare but real. While rare, blue or green urine is a phenomenon that may occur due to certain medications, food dyes, or even rare metabolic conditions. If you've recently eaten foods with high levels of blue or green dyes, such as candy or sports drinks, this could temporarily change the color of your urine. However, if this happens without any dietary cause, it's worth investigating further. A common medication that may cause blue or green urine is the antibiotic methylene blue, which is sometimes used to treat urinary tract infections or methemoglobinemia. Additionally, a rare genetic disorder known as familial hypercalcemia can also cause blue-colored urine due to increased levels of calcium. This condition is usually harmless but should be monitored by a healthcare provider. You've just learned about the most common urine colors and what they could signify, but what about those colors that are not as easily explained? What if your urine color doesn't seem to fit into any of these categories, or if it suddenly changes unexpectedly? These outliers could be signaling more complex health issues, and ignoring them could have consequences. As you age, your body's responses become more nuanced, and subtle clues can sometimes lead to big revelations about your health. What should you do if you're noticing unusual patterns that don't seem to make sense? Let's take a closer look at those rarer urine colors and what they might mean for your health after 70. Cloudy or milky, possible urinary tract infection, UTI, or kidney stones. Cloudy or milky urine is often a sign of something more concerning. While occasional cloudiness can happen after consuming certain foods or medications, persistent cloudy urine is usually a sign of an infection, most commonly a urinary tract infection, UTI. UTIs are a common issue for older adults, particularly for women, due to hormonal changes and a higher likelihood of conditions like bladder incontinence. When the urine becomes cloudy, it's often due to the presence of white blood cells or bacteria. Alongside cloudy urine, you may notice symptoms like a frequent urge to urinate, pain or burning during urination, and lower abdominal discomfort. In some cases, cloudy urine may also be accompanied by a foul smell. While UTIs are generally treatable with antibiotics, leaving them untreated can lead to more serious complications, such as kidney infections, which can be more difficult to treat as you age. Cloudy urine can also indicate the presence of kidney stones, which become more common as you age, especially for those who may not be drinking enough water or have a history of certain medical conditions like high blood pressure or diabetes. Kidney stones can cause intense pain, especially if they are passing through the urinary tract, and may result in cloudy or blood-tinged urine. If you suspect kidney stones, a visit to the doctor for diagnostic tests, like an ultrasound or X-ray, will be necessary to confirm the presence of stones and determine the best course of treatment. Orange, medication or liver problems. Orange urine can sometimes be traced back to medications. For seniors, medications are an essential part of life, but they can come with side effects that affect urine color. Common medications that can cause orange urine include rifampin, a drug used to treat tuberculosis, and some chemotherapy drugs. The color change happens due to the way the body metabolizes these drugs, and while it's typically harmless, it's important to be aware of it so that it doesn't cause unnecessary concern. However, orange urine can also be a sign of liver or bile duct problems. Conditions like jaundice, which causes the skin and eyes to take on a yellowish hue, can also result in orange-colored urine due to the increased presence of bilirubin, a substance produced during the breakdown of red blood cells. This condition is more common in older adults who may have liver disease such as cirrhosis, hepatitis, or a bile duct obstruction. If your urine is orange and you are not on medications that could explain the color change, it's important to consult with your healthcare provider to rule out liver issues. Early detection of liver problems can make a significant difference in treatment outcomes, especially for older adults whose liver function may naturally decline with age. White or milky, lymphatic or kidney issues. White or milky urine can sometimes be an alarming sight, as it could indicate the presence of lymphatic fluid or proteins in the urine. When this happens, it's usually a sign of a more serious issue such as nephrotic syndrome or kidney disease. Nephrotic syndrome is a condition in which the kidneys leak large amounts of protein into the urine, causing it to appear cloudy or milky. This can be caused by various conditions including diabetes or high blood pressure, both of which are more common in older adults. In some cases, the milky appearance could also be linked to a condition called chyluria, which involves the presence of lymphatic fluid in the urine. While this is rare, it can occur if the lymphatic system is blocked, often due to a parasitic infection like filariasis, which is more common in certain regions of the world. Though chyluria is unlikely to affect most seniors, it's something that should be checked out by a doctor if you notice milky urine consistently. Another potential cause for white or milky urine is a urinary tract infection, UTI, that has progressed to involve the kidneys, known as pyelonephritis. This condition, if untreated, can lead to kidney damage and potentially even kidney failure. If you experience any additional symptoms like fever, pain in the lower back, or blood in your urine, it's important to seek medical attention right away. When should you worry? For those over 70, any unusual or persistent change in urine color warrants attention. Though some color changes are harmless and simply indicate things like diet or hydration status, others can point to serious health issues. It's important to listen to your body and pay attention to any accompanying symptoms, such as pain, changes in frequency of urination, or feelings of discomfort. These signs, when paired with unusual urine color, could help your healthcare provider diagnose the issue more accurately. If you're ever uncertain about what your urine is telling you, don't hesitate to seek professional advice. Early intervention is often key to preventing further complications, especially for seniors whose health can change more rapidly than younger individuals. Your urine color can provide vital clues about your overall health, especially as you age. While some changes may seem insignificant, ignoring unusual urine colors can lead to missing important signs of potential health issues. Whether it's dehydration, kidney problems, or something more serious, taking action early can make all the difference in your treatment and recovery. By paying attention to what your urine is telling you, you're taking an active role in your health, something that's especially important as we get older. As we've seen, changes in your urine color could point to common issues like dehydration or simple medication side effects. But what about the rare cases? What about those situations where the color change is the tip of the iceberg for something more severe? Imagine noticing a sudden shift in your urine's color that doesn't seem to fit any of the usual patterns. What if it's not just the effect of what you ate or drank? Let's take this a step further. Have you ever wondered why certain colors like dark brown or red seem to be linked to conditions like kidney disease or bladder cancer? What's happening in your body that could cause something as harmless as a color shift to become a serious health warning? And what if the real issue is something even more unexpected? Something that could fly under the radar for years, only becoming apparent once it's too late. In the next segment, we'll dive deeper into these unusual cases, revealing how certain urine colors can be linked to hidden health problems and what you can do to protect yourself. Stay with us, because what you learn could change the way you look at your body's signals forever. But here's the twist. What if I told you that some of the most alarming urine colors could be linked to something as simple as a lifestyle change? That's right. While we often think of urine color changes as red flags for serious conditions, sometimes they are merely an indication of something you have the power to control. Imagine a situation where your daily habits, like what you eat, drink, or even how much you sleep, are responsible for what you see in the toilet bowl. For example, certain foods and beverages can cause your urine to temporarily take on unusual colors. Beets, for instance, are known to turn your urine pink or red, but most people don't realize this until it happens. Similarly, asparagus can cause a distinct odor, and coffee or certain vitamins can darken urine, making it seem as though something more serious is going on. So, before you panic over that sudden color change, take a moment to reflect on your diet, hydration levels, and overall lifestyle. Sometimes, the most dramatic urine color changes are nothing more than harmless side effects of what you've consumed. However, if those changes persist or are accompanied by other symptoms, that's when you should start worrying. Now that we've uncovered the hidden meanings behind various urine colors, it's clear that your body is trying to communicate with you. Whether it's a sign of dehydration, a diet issue, or something more serious like kidney disease or bladder cancer, paying attention to your urine is one of the simplest ways to stay on top of your health, especially after 70. But here's the crucial part. It's not just about recognizing the colors, it's about taking action. If you notice any significant changes in your urine color, don't just brush it off. Track the color changes over time and pay attention to any other symptoms that might appear. If your urine becomes consistently dark, red or cloudy, or if you experience pain, fever or unusual discomfort, it's time to consult with your healthcare provider. Even if you're not experiencing any concerning symptoms, regular checkups with your doctor are essential as you age. Your kidneys and urinary system undergo natural changes over time, and your doctor can help monitor these shifts to ensure everything is functioning optimally. Routine tests like urine analysis can detect hidden issues long before symptoms arise, giving you a head start in preventing severe health conditions. As we've discussed, lifestyle plays a massive role in urine color. Drinking plenty of water, maintaining a balanced diet, and limiting substances that can affect hydration or kidney function, like excessive alcohol or caffeine, will help keep your urine within the healthy color range. Additionally, staying active and managing stress levels contribute to the overall health of your urinary system. Remember, though, that not all color changes are linked to lifestyle factors. Conditions like infections, kidney stones, or even certain cancers can cause alarming changes in urine color. So, when in doubt, always err on the side of caution and reach out to a medical professional. It could be the key to catching a potential issue early and ensuring a long, healthy life. Now that you understand what your urine color might be telling you, don't ignore these important signals from your body. Make sure to stay hydrated, be mindful of your health, and keep an eye on any changes that could indicate an underlying issue. If you notice something unusual, don't hesitate to consult with your healthcare provider. Early intervention can make all the difference. If you found this video helpful, make sure to hit that like button and subscribe to the channel for more health tips and insights. Share this with your friends and family, because you never know who might need to hear this information. Your health matters, and taking action today could lead to a healthier tomorrow. Also, let us know in the comments if you've noticed any changes in your urine color and how you dealt with it. We'd love to hear your experiences and keep the conversation going. Thanks for watching, and remember, stay hydrated and stay healthy.